This is an ABC podcast.
COVID-19 seems to be affecting kids like never before. Queensland's outbreak is still small next to Sydney's, but the virus is concentrated in schools. For example, on Monday, the state recorded 15 new cases, and 10 of them were children younger than 9. In fact, pretty much everywhere in the world that's battling the Delta variant has more children sick this time around.
Indonesia has some of the highest rates in the world of COVID-19 infections and deaths among children. More than 600 children have died from COVID since the pandemic began.
I'm Ange Lavoie-Pierre.
And I'm Stephen Smiley, and today on The Signal, Australia's current COVID-19 outbreaks are not slowing down and more children are being diagnosed every day. So how much worse is Delta for young people?
It's become the grim soundtrack to the pandemic in Jakarta. Residents across the capital hear ambulance sirens blaring all day and night.
In what's been called an escalating crisis on Australia's doorstep.
From 5,000 cases a day now to 29,000 cases a day.
Daily deaths are around 1,000 a day, and health experts predict case numbers will continue to rise as the Delta variant spreads beyond Java and Bali to more and more Indonesian provinces.
So as bad as Australia's outbreak feels in contrast to our long stretch of COVID zero, it's still infinitesimally small compared to what's happening to our north in Indonesia right now.
Yeah, so we've talked about the enormous surge there on the podcast before, and it has only got worse since then, including a spike in cases amongst children and young people.
Well, my name is Helena Soisa. I'm a journalist with the ABC Asia Pacific newsroom in Melbourne.
So Helena has been covering the surge in Indonesia and has watched the pattern in the caseload transform.
In the past, the death rate for COVID-19 in Indonesia was dominated by the elderly, ranging from the age 60 years and above. But I just checked the data from the Indonesian Ministry of Health. Now 30% of the total positive case are those aged 31 to 45. And the second biggest number aged from 18 to 30 years. And as many as 22% are aged 46 to 59. And only 11% are elderly. What is also sad is the high number of positive cases in children aged 6 to 18 years. It is 10%, and children under 5 as much as 3%. So yeah, the number is quite different than, for example, 6 months ago even.
So you and your colleagues have been speaking to the parents of some of those children who, in some cases, have died from COVID-19, from the Delta strain. What have they told you about their experience?
Well, some parents admitted that they did not think that COVID could also happen to their children. So there is an assumption that children are less vulnerable than adults. I think this is because the messages and health protocols announced by the government never mention children specifically, so that there is less attention to children. And this is what the parents told us about. Like they don't know whether they have to put mask on their children or not. And I think that the question is still unanswered by the government, so that policies related to children mostly depend on the parents.
Okay, so from what Helena is saying, the Indonesian government, and that includes the health system, were not at all prepared for the impact of Delta on young people. And she says it's not clear when the surge will come to an end.
This is a tough one. I think almost all experts that I talk to, whether they're epidemiologists or statisticians or mathematicians who run the model and try to find whether the curve is flattened or not, they all have a hard time estimating the outbreak in Indonesia due to the inaccurate data that they have now.
Okay, now with Delta spreading in Australian schools among other places, we wanted to know, what does the science have to say about that pattern?
My name is Christine McCartney. I am the Director of the Australian National Centre for Immunisation Research and Surveillance, and I am a professor at the University of Sydney.
What do we know so far about the risk to young people and children from Delta, in particular, in contrast to older variants?
Well, we're seeing Delta be so much more transmissible and easily spread in the community that we know it is affecting children and young people more readily. We might have seen previously, one person, say mum or dad had been out and caught the virus, they would be relatively unlucky to transfer it to more than, say, one person in the household. And children were rather unlucky to be infected, but they mainly got infected in the household. Now, within a few days, mostly everyone in the household is being infected.
Okay, so is it a function then of the higher transmissibility alone, or is there something innate about this variant that makes children more vulnerable?
Well, that's been the tricky part to pick out. And there is a suggestion that the virus across the board may be more severe. Again, those studies have only largely been done in adults so far. But they're suggesting that, for the proportion of cases which we expect to be hospitalised, that some of those, if they're not vaccinated, of course, will be more severe when they are in hospital. It's really hard to study this because, as you can imagine, if you're seeing more infections, you're naturally seeing more hospitalisations. Around only 3% of children will have severe disease, and many of those still won't even end up in hospital. And there have actually been very few child deaths from, COVID-19 across the entirety of the pandemic. Children do still tend to have milder disease and a lower likelihood of having complications, but it's certainly not, a guarantee that they won't become ill.
Right. And with Delta, we are seeing those figures change, it's fair to say. Is that right?
Well, the other trick is that we now, in countries that are doing the best studies, of course, have many adults vaccinated. And even in Australia, where we're still only at 20% of the adult population fully vaccinated, we are seeing less disease in those who are the vaccinated adults, such as very old people in nursing homes. And it's younger people and indeed, still in some settings, teenagers, where they're out and about in the community, sometimes doing, those essential jobs or going to school or, mixing. And inevitably, again, we'll see Delta spread in that environment.
Okay, so some of the vulnerability is circumstantial. It's to do with not being vaccinated and the fact that young people and children are still, whether it's going to school or, working in delivery jobs or whatever it is, they're more active.
Yeah, that's exactly right. So we have to remember that to the entire human population, we've never seen this virus. We don't have any immunity to this virus. It infects anyone of any age. It actually, the studies tell us that children are infected pretty much just as readily as adults. I mean, a striking fact is that in some parts of London, which of course have been hit by the pandemic incredibly hard, almost up to 50% of children in some parts of London have been infected with the coronavirus. Now, many of those, weren't even necessarily ill, and some of those, of course, were at the other end of the spectrum, and they did get complications.
Okay, so let's see if I've got this right. It's not as if Delta poses a special risk to children, it's that it poses an increased risk to everyone across the board.
Yeah, that's absolutely right. Delta does pose an increased risk to everyone across the board, and children aren't left out this time as much as they were last time.
Right. And is there any ambiguity about that question, whether children might be affected in some special way, or is it an open and shut case as far as you're concerned?
Well, I think there's not a lot of ambiguity at this stage. We're not seeing strikingly more severe disease in children with Delta. We're just seeing it in much greater numbers. And whether the disease is a little more severe or not, we need more detailed studies on that. I suspect it might be somewhat more severe, but it's not striking. So, again, it's that balance between, getting people to appreciate how serious the virus can be, but also making them not overly worried if their child is infected, that is necessarily going to have a serious outcome. We need to get that balance right.
Right, so some ambiguity there about whether Delta is worse for young people than the rest of the population, but Christine seems convinced that it's at least not markedly worse.
Right, but the fact that kids are vulnerable to it at all is a game changer from an epidemiological perspective. Because even if young people are still less likely to get very severe forms of the illness, having it at all means they can pass it on, which is why we're starting to see children and young people factored into the vaccine rollout in a more serious way.
So one example of that came earlier this week when the recommendation from Australia's vaccine advisory body ATAGI changed again so that 220,000 children between the ages of 12 and 15 could get the jab from August the 9th. Here's the Health Minister, Greg Hunt.
Pfizer vaccine will now be made available on ATAGI's advice for immunocompromised children or children with underlying medical conditions, Indigenous children and children in remote communities aged 12 to 15.
In fact, there is a review on at the moment for all children in that age group, with results expected in about a month's time.
So, yes, we are seeing children now included in vaccine programs. In parts of the world where vaccination rates have grown very high in adults, like Israel, the United Kingdom, Canada and the US, they are now offering vaccine to children in this newly registered age group of 12 to 15 years. Of course, the vaccine being used there is Pfizer vaccine. It's the only vaccine registered for teenagers at the present time. And countries such as the United States have now vaccinated over a third of their teenage population.
Is that the right move, do you think? Is that something that Australia should be prioritising too?
I think for a country like the United States at the present time, that decision is very wise. And that's for a number of reasons. It's partly because their vaccination rates in adults aren't as high. The other reason is they've been battling COVID non-stop in the US. It's circulating in the community, never been fully suppressed. And, when they looked at the number of hospitalisations and other harms from COVID-19 in children, even though it's lower than adults, they still saw benefit both to the teenagers themselves and to interrupting the spread of the virus across the community through herd immunity. So for the United States, at the time they've introduced, yes. For Australia right now, the imperative for us is to get vaccination rates high in adults and older adults who are more at risk of COVID and younger adults who are moving around more in the community.
So it sounds from what Christine McCartney is saying that because the evidence isn't there to show that Delta is significantly rougher on kids, and because the rollout has been slow with adults, over 18s should remain the priority for vaccination, at least for now.
Right. Even if not vaccinating kids means schools will still need to stay shut whenever there is an outbreak.
If, anyone here is not vaccinated, the chance of them coming to school with the infection is higher. We're still not seeing such high transmission rates in schools. That we've got preliminary data that is being worked through with New South Wales Health that tells us that when you see a case, it's not like a household where everybody's infected. There's still relatively low transmission rates in schools. But the problem is it's like the horse is bolted, because once you get one case in a school, you still have to do all of those public health measures. So I think schools are challenging to operate when there is a high transmission rate of Delta virus in the community, because the risk is there, just there.
And so do you think we've got the settings right in New South Wales at the moment when it comes to schools, or do we need to revisit that question?
Look, at the present time, we have too much community transmission to be opening schools, and I think that we have the settings correct at this time. It is heartening, though, to hear that there is going to be, in those most affected areas, vaccination of teachers and Year 12 students undertaken, and to allow them to get back to working face-to-face in the classroom. So it's all about the whole community working together to suppress the virus at this stage while we're waiting for vaccination to climb, and that will allow kids to get back to face-to-face teaching, as soon as possible.
That is The Signal for today. If you'd like to get in touch, our email is thesignal@abc.net.au, and we will be back here in your feed at the same time tomorrow.
Catch you then. Bye.
Bye.
You've been listening to an ABC podcast. Discover more great ABC podcasts, live radio and exclusives on the ABC Listen app.